Hi, my name is Tara Frank. I am a student physical therapy student, and today we are here to address belonging and burnout. And this is our proposal for the Hope Commission. And so today we're going to follow along if you want to go to the next slide. This is our outline for today. So we're going to kind of go over some background of our case. We're going to talk about some of the things that we really care about that are leading us to come to this proposal. Then we're going to go through our proposal and then some considerations and effective communication just to kind of tie it all together. And so to start, if you want to go to the next slide, we've got our case background. So the case we're working with today, we've got our team members, which include family medicine physician, registered nurses, nursing assistants, pharmacist, unit clerk, social worker, environmental services staff, and administrative staff. And so they came to us and these are their concerns. So the first one's fair monetary compensation. And so there's considerations of leaving their current job to find higher paying jobs. And then there's the consideration of they're feeling underappreciated, unfair, things like that. Another point brought up to us was the loss of interpersonal relationships. And so all the team members really want to have that good relationship, but it's interfering with their efficacy because they want to spend more time with their patients, but they have a bigger patient load. And so just trying to balance all of that. And then when COVID has been on the rise, it's been really straining relationships because people have been forced to have form opinions and are they safe to share those opinions, things like that. Another thing we've talked about with them is managing obligations outside of work. So their familial, their finances. They feel like they're not having as much time to spend with their families. They're bringing their stresses from work home with them. And then they're also dealing with not only pandemic patients in the hospital setting at work, but then also at home if they're being personally affected by it. And so all of this wrapped up is basically there's increased stresses and responsibilities put on them by the pandemic. And at this point, there is no end in sight. We don't see the light at the end of the tunnel yet. And so our goal is to address the burnout that our team members are feeling and address the other barriers that are impacting the healthcare team.
All right. So, hello, my name is Austin. I'm going to be talking a little bit about radical belonging, what it is, and why we must promote it. Okay, so our team definition of radical belonging, we defined it as such. Radical belonging is a foundational practice which aims to actively create environments and policies that acknowledge the multiple factors involved in marginalizing and excluding communities in order to ensure that all members have the same sense of empowerment and attachment to an organization. One article found that this sense of belonging is important because oftentimes there's a gap between the desired outcomes of certain social inclusion policies and the everyday experiences of those members who are often excluded, and the concept of belonging can help narrow this gap. There are negative consequences associated with this increased feeling of, this lack of belonging. This gap creates adverse patient outcomes. It can increase employee dissatisfaction, and it can increase employee burnout and turnover. And a prime example of this is the COVID-19 pandemic. The definition of radical belonging needs to take into account multiple factors, some of which being social, academic, cultural, and economic, and it requires active participation by all members associated with the organization. So why are we promoting radical belonging for our teams? Well, one article found that an increased sense of belonging leads to improved confidence and overall quality of work. This is due to the increased self-efficacy that inclusion nurtures. And this makes sense. If you feel more attached to a team, you're going to want to work harder. You're going to feel like your work is more important. And so you're going to work harder. You're going to apply yourself more because you don't want to let your team down. Some increased benefits associated with increased belonging in the workplace has shown increased job performance, increased reduction in turnover risk, and decrease in the usage of employee sick days. That same article found that 7 out of 10 employees reported that their institution failed to address inclusion, and unfortunately, St. Louis is no exception to this statistic. And it also stressed the importance of including the entire team in processes that will affect change, and lack of doing so risk marginalizing certain members and or groups within the organization. So how did the pandemic affect belonging in healthcare teams? So the effects of the COVID-19 pandemic have severely decreased the sense of belonging within healthcare teams. Part of the reason for this is because there are less outside of work community events, and this is due to a multitude of reasons, one of which being social distancing, but also people have been working harder and more often so that when they do have free time, it's often spent relaxing or staying to themselves. Vaccination and masking policies have been very polarizing and often divided different members of teams. There have been a lot of team member turnovers. This has led to increased hours, and this has led to poor patient outcomes. There's kind of been this vicious spiral of the pandemic forced people to retire. This led people to work longer hours. This led to more people to resign, and this led to even longer working hours. There have been socioeconomic impacts of COVID-19, which further lowered this sense of belonging. Some of which being people's kids had to stay home from work. This kind of isolated single mothers because they couldn't go to work because their kids were at home. And so this is just one example of how COVID-19 can isolate certain groups in ways that you don't necessarily consider all the time. And one article found that companies that had more inclusive work climates were more likely to have programs such as remote work, as this was beneficial for parents, women of color, people of color, and people with physical disabilities.
All right, my name is Alec. I'm one of the medical students, and I'm going to be discussing the impacts of COVID-19 on our minority populations. We know that while COVID significantly impacted everybody across the board, across gender, age, and race, we also know that statistically, our minority populations, both racial and age-wise, were more likely to suffer adverse consequences to COVID-19 than their white and young counterparts. Notably, Black individuals died at rates 380% higher than their white counterparts. Latinx communities accounted for a quarter of all COVID-19 cases, and they experienced the greatest number of overall deaths, despite the fact that they make up a smaller proportion of US population. Early data also noted that in 23 states that indigenous populations experienced the medical burden of COVID-19 at rates 350% higher than white folks did. And again, people of color really suffered a lot of the social consequences, much more than white folks did, in the same way they suffered medically. There was a huge increase in hate crimes against Asian American and Pacific Islanders across the US. The FBI noticed that rates went up 77% in terms of hate crimes against AA and HPI individuals from 2019 to 2020 during that first year of the pandemic. Additionally, Black kids and Indigenous kids lost their caregivers at much higher rates than white kids did. Black children were 2.4 times more likely to lose their caregivers, and Indigenous kids were 4.5 times more likely to lose caregivers. And of particular importance to Indigenous communities, tribal elders were particularly susceptible to COVID-19 and died much more often than others did, which led to a very serious loss of culture for younger generations of Indigenous folks, as they lost unwritten language and stories. The traditions are no longer able to be passed down, and ceremonies that were led and shared by elders have been lost secondary to these deaths. And finally, we need to be able to discuss the impact of COVID-19 on our geriatric population. While they had a lower number of cases of COVID-19 across all populations, people 50 and above made up 95% of all COVID-19 and COVID-19 related deaths. And those who required community assistance for their daily needs were much less likely to be able to get those as companies closed. They were unable to offer these services at the same rate because there were decreased hours, fewer individuals available, and some of them even stopped offering services altogether. And those who required daily assistance suffered even more significantly, because whether it was in terms of family home nursing groups or residential facilities, they were unable to follow mandated social distancing policies, which made it impossible for them to meet their needs for their social, functional, and medical assistance. Older individuals living in long-term care facilities also noted 46% of people who were living in these facilities were experiencing anxiety and depression, secondary to the fact that they were isolated from their family members, which is much higher than what they've been reported at in the past.
And so we talked a little bit about how the patients have been affected by this pandemic, but not only they, but also healthcare workers and healthcare team members have also been affected. This first bullet point says a projected 16% increase in the need for healthcare workers through 2030. And then the healthcare sector has lost nearly 500,000 workers from February 2020 to November 2021. So basically, our supply is going down, but our demand is going up. So, like I mentioned earlier, that's leading to a lot of burnout, and it's putting a lot more stresses on the current healthcare workers that we have. And so that can lead to inability to provide care. It increases the risk of making medical mistakes. And then outside of work, these healthcare workers are experiencing more fatigue, exhaustion, and they're experiencing, like mentioned below, compassion fatigue. So it's making it harder to do their job.
Hello, everybody. My name is April. I'm a medical student. So just briefly want to talk about how COVID also impacted, healthcare students and trainees. So thinking about students like us, during this pandemic, there was minimal exposure to actual patient interaction just because of the high demands of the hospital and the risks that were associated. There was minimal exposure. In addition to that, there was also less interaction with other healthcare professionals. So with that, communication is important to also understand the roles of other professionals in this field. And so when you don't get to actually get into that clinical environment, it's difficult to try to understand what they are doing for a patient. There was also stressful and overwhelming learning environments, meaning that, even when they did get into the environment, it was pretty stressful because trying to figure out how to manage all of these COVID patients and, also trying to find time to learn about other conditions that existed. Also, mental health challenges. So the CDC found that 31% of adults in the US were reporting symptoms of anxiety or depression in 2020, nearly double what it was before the pandemic. And that is not to say that our students did not have the same things. So the stress and the demands of medical education, of pharmaceutical education, nursing education, and still trying to make sure you're prioritizing patients was pretty difficult. And then lastly, some of these people reported entering respective fields with less in-person experience or confident than those who entered the fields before them. So because of the lack of clinical exposure during training and educational times, when they finally got the time to actually put it into practice, what they were supposed to learn, they reported that, they had less confidence than those who came before.
My name is Courtney Krogan. I'm a pharmacy student, and I'm going to go over why we see all these outcomes. There's higher burdens of chronic disease. It also leads to the lack of access to private transportation. People of color more often work in essential services, so that requires them to work outside their home throughout that pandemic. Poor access to private health insurance. Healthcare hesitancy secondary to historical and current racial disparities. And then the high care volume and risk posed to learners in the healthcare professional schools.
All right, my name is Amani Hall, and I am a nursing student at SLU. And for our proposal, we're first going to address how to promote radical belonging. So our goal is to create a respectful environment that encourages a sense of belonging with a focus on inclusion, equity, and diversity amongst professionals and the serving communities. Some things that can do this is by providing education and training on topics that address barriers that prevent a collaborative environment. And some of the most talked about things are racial and implicit bias that can influence a lot of decisions that are made, health literacy, and unhealthy expectations and unsafe practices. Another one is analyzing data from surveys to review problem areas and to create measurable goals that everyone feels comfortable achieving. And lastly, encourage open communication that dismantles the influence of hierarchy and fear. And this often opens up a stream for open communication where everyone feels like their opinion is heard.
All right, hello. This is Austin again, a medical student, and I'm going to talk about how we plan to kind of implement some of these ideas to improve radical belonging. So some of our short and long-term goals to promote radical belonging, we want to include all members of the organization in conceptualizing, designing, evaluating processes within the organization to improve one's sense of belonging. We can do this via patient surveys on how they think we can better improve our hospital, or another example of this is getting floor nurses' inputs on scheduling policies and decision-making. Another example of something we could do is provide reflective sessions so that individuals can share their experiences and how certain decisions impact different members. A perfect example of this are certain vaccination policies. Some people have certain religious beliefs that may have prevented them from getting the vaccine, and certain policies that hospitals or health institutions can put in place can really isolate certain individuals. So it's important that we hear their experiences to help them feel more belong. Another example is we can do informational sessions to learn about how historical factors have contributed to healthcare disparities that impact certain patient and employee populations. We can also encourage all members of an organization to participate in different events, community events, different decision-making events. You can do sort of like, we do medical school town halls in order for people to sit in and kind of listen to what's going on with different parts of the school. And then the last example that we have is we want to create safe environments so that individuals can, again, share their experiences, beliefs, and ideals to ensure that constructive conversations can be had. Again, the last slide talked about having open lines of communication. We want to have constructive conversations. That's the best way to make people feel more belong when you're working in such large institutions.
Okay, this is April again. And so now we're gonna move and transition a little bit to some proposals that we have for, making marginalized communities feel at ease, those that have been impacted by COVID-19. So some of the things that, of course, like we could implement so many things, but these are some things we decided to focus on. There's so much that can be done. But the first priority is local community outreach, right? So a lot of this is meeting a patient where they are. Sometimes transportation, finances, all these different type of barriers to healthcare are things. And if we can meet a patient where they are, then we can probably alleviate some of those barriers. So, for example, a mobile healthcare bus or something to get out into the community to do vaccines or to do screenings of different types of things, visiting churches, banks, grocery stores, meeting these patients where they are. Another thing that is super duper important is hiring more diverse healthcare professionals, because like let's be serious, like when we think about some of these communities with these marginalized patients who just are impacted by COVID, a lot of them are patients who are, we've been talking about it all night, of color, Black, Latino, whatever the case may be. So if we have more diverse professionals, then these patients might feel more comfortable being able to go seek out medical attention, or might be more likely to come back and follow up with. So thinking about different types of intersectionalities with these patients, if they see somebody who looks like them, they are going to be more likely to seek out the care that they need. So with that, we also want to make sure we are focusing our recruitment and retention efforts. So whether it's doctors, residents, nurses, whoever the case may be, whoever is patient facing, we want to make sure that they see these people. And then lastly, more funding for community-based hospitals. If we think about like an institution like SLU Hospital, right? So marginalized patients are more likely to go to these places, and they might be underfunded. So we want to make sure that we get the money that we need, do the outreach that we need to do to make sure we get enough funding for these places, so that we can have more people on board to help patients and support them. Thinking about social work, case management, placement, resources, having the resources that they need so that they can be successful. And then in addition to that, you also will be less likely to have so many high out-of-pocket expenses. Like a lot of these patients don't have insurance either. So we want to make sure that we have some funding to give patients what they need, and they don't have to worry about financial burdens and strains. And then lastly, just wanted to talk about, physicians sometimes have to meet quotas, or they have to do a lot of these procedures to like get adequate compensation for their time and for their work. But if we have more funding, then physicians will feel more comfortable with providing like holistic care. So that's something to think about.
All right, my name is Amani, and I'm going to be addressing this slide, and it's basically just the extension from the previous slide that April did. So some short-term goals that we can do is set up local vaccination clinics and free checkups in the communities. A lot of times there are barriers that prevent these people in marginalized communities from receiving care, whether it's transportation needs or not having, health insurance. So setting up free services that can help them a lot is really helpful. Providing supplemental education pamphlets on different health issues and services. One that I can always think of is type 2 diabetes. So the ways to manage your diabetes, the different medications and things like that is really helpful to them. Recruit more employees with diverse backgrounds. Like April said, a lot of people will feel more trusting or more comfortable being taken care of by someone that looks like them. So that's really important. Long term, Residents of the community and social workers will collaborate to start at home visits. Like I mentioned before, there are a lot of barriers that prevent people from receiving health care or going to the hospital. So they might need at home visits, and that can help a lot. Hosting fundraisers to provide residents with essential equipment and develop community clinics. Something I can think about is blood pressure cuffs or manuals. Handing out those to people where hypertension is really prevalent is really helpful in them, like, learning their medication and things like that. So some costs. Readmission to the hospital can cost the healthcare system and patients a lot of money. Healthcare should be equitable despite the incurred costs of the aforementioned proposed interventions.
Okay, it's me again. So next we're gonna pivot and talk about, some interventions for healthcare workers. We want to support them too, because as you know, they were on the front lines during the COVID-19 pandemic. So first and foremost, we need more of them. Like, it's not enough. So we need to hire more employees to ensure adequate staffing, and that the people who are working have time off. Like, come on, burnout is real. People working 7-day stretches, that's not really ideal. And of course, that's more likely to lead in error, medical error, more expenses. So we want to make sure that the people who are working, we support them and give them time off. So we need to hire more. We need to let them spend time with family. We talked about that. Work isn't everything, and we need to allow them some time and space to process things that they might have seen from work that might have been traumatizing or something that they've been grieving. So we want to prevent burnout and mistakes. So hiring more people will help us do that. Next, we talked a lot about financial barriers. Competitive pay, I think that's really important because, like, here we are working on the front lines all day, every day, trying to make sure that our patients are seen or heard or, treated optimally. But then we have people who can't support themselves, support their families. And this isn't even just professional students. These are people like CNAs or like medical assistants. We want to make sure that they have enough pay, so they can have financial liberty and motivation to work. Austin talked about that a little bit earlier. So we want to make sure that, we are inhibiting as many errors as possible and we are supporting our employees and staff. Then lastly, free therapy to promote help-seeking behavior. So if somebody is going through something, maybe it started at work. We want to make sure that they have the assistance and the help that they need so that when they do come back to work, they are working at the optimal level they can. So there's a resource here that showed that employees with increased emotional distress and anxiety, that can sometimes come from high volume. So we want to make sure that despite all of that, we are supporting them. And we want to promote emotional and physical well-being in our employees because COVID was a tough time. So we want to make sure that their mental health was also fine, even outside of their work setting. So
This is Amani again. So I'm going to be addressing some steps that we can do for health care workers. For short term, we can develop support groups that allow employees a safe space to voice their concerns. Oftentimes, if there's like a mistake, a lot of people are scared of speaking up because they're afraid of punishment. But actually, having an environment where you feel comfortable speaking about what's going on actually has a lot of positive impact. Encourage management to develop a trusting and supportive relationship with their staff. I know myself, my management is a big reason why I'm still at my job, and really having people that you feel like are on your side and there to encourage you to be your best, it really does impact your performance. Adequate pay for employees and host career growth opportunities. COVID took a lot from everyone, and adequately being paid for what we've gone through, I think that's more than fair. Long term, maintaining appropriate staffing and facilities to provide a safe work environment for healthcare professionals and safe patient care. There's no reason why there should be like unsafe staffing ratios when there's a lot of people that want to work. Advocate on the behalf of patients, and not just in like the hospital, but like on a national level. So like helping to implement policies that create, safe staffing or violence against healthcare workers is really important to us. General costs, therapy may be expensive, but if healthcare workers aren't well, this could cost the healthcare field tons of money and mistakes. And patients in the hospital longer than necessary due to poor communication can be expensive. So minimizing those will be really helpful.
Hi, I'm Annie, and I'm an occupational therapy student at SLU, and I will be talking about how we will be measuring success. So what is our metric for success? Our metric of success is that 75% of staff will report expected scores on survey of staff satisfaction after 2 months. Staff retention rate and patient satisfaction are two factors we would like to see have successful rates as a result of our interventions. High staff retention rate will signify the satisfaction of the staff with their current jobs, and high patient satisfaction will signify the high level of care provided to the patient. Is this sustainable for other healthcare settings and organizations? This survey can be adjusted to better reflect other settings with more specific questions related to the site and questions that align with the goals and the mission of the site. And retention rate and patron satisfaction are factors that can be assessed at any place of business.
Hi there, I'm Olivia, and I'm a physical therapy student. I'm going to talk about what we learned about effective communication through IPTS and working on this case. So the first is the transfer of knowledge and ideas. Doing this helps to define roles on the healthcare team and the demands of each group member and how we can help one another by understanding what everyone's concerns and priority jobs are within the team. Something that I think our group excelled at were engaging in productive discussions. We were able to get input from all team members, and then we also would seek out information from specific team members when we needed to hear from a certain specialty about a case. This also helped us with critically thinking through priority concerns for the patient that we would want to address within each case. Another thing we learned about effective communication was it helps develop trust, and this is seen through the patient and provider by building that therapeutic alliance and showing the patient that we are supporting them through a hard time that they are having. Another situation would be colleague to colleague, and that is shown through efficiency in handoffs and decision making and continuity of care within each discipline and between disciplines as well. Another thing we learned was that the effective communication decreases the chance of future conflict. So by expressing concerns and providing your point of view, you will help eliminate unknowns and remove the need to make assumptions or inferences about another provider's decisions. And then overall, we just learned that effective communication improves the workplace atmosphere and patient outcomes. And then these are our references. Thank you for watching and listening.